Welcome in, everyone. Today is our last part of our three-part session on childbearing education, hormones, and healing. So today we're going to be talking mostly about the postpartum phase and what to expect, as well as how to support yourself best within that first 40 days, culturally, as well as just thinking about all the work that your body has gone through. The first 40 days is really important to ensure that your healing takes place in a seamless way and you are surrounded by plenty of support so that you can focus on feeding your baby, taking care of yourself, and ensuring that all the other things that you have, life stuff going on, the dishes, all the to-do list, that stuff is being handled by other folks. So today, like I had mentioned before, we're going to talk more about postpartum healing and what that entails from the space of right after delivery on the physical side, all the way through to about that 3 to 6 week mark. So here's a legal disclosure. The legal disclosure and release of liability. The information in this publication is not to be used or construed as medical advice. It is not intended to replace the care of a licensed healthcare provider. The information shared in this publication is created to inform families and birthing people about common knowledge regarding pregnancy, hormones, labor, delivery, and postpartum healing. All information that was not written by the author has been credited. The publisher, author, illustrator, editor, and Simply Ellen Holistic Services LLC are not liable for any loss, damage, or injury incurred directly or indirectly as a result of any information shared in this publication. Okay, so let's chat about postpartum healing. So, postpartum healing, you got through the hard part, right? You delivered, you birthed your baby, you built your baby, you birthed your baby, and now it's time to heal. Now, I'm looking at this from my own cultural standpoint. I am a Black woman and I've grown up in the United States, but use whatever your culture is and what your aunties and your grandmother and your all the people around you, what have they done when they have birthed babies? How have they prepared themselves for postpartum while they were pregnant? As well as on the back end, how was the community surrounding them, and then what was that process like? What are the wins? What are the things that you want to hold on to, and what are the things that you would like to, shift and maneuver to be efficient for your life? So this section will review the physical healing process, nutrition for healing and breastfeeding, and identify signs of perinatal mood and anxiety disorders. On the recording. Okay, so let's talk about it. So we're hoping that we have a working understanding when we finish today of being able to identify signs of labor recovery and healing. So that really boils down to understanding what the signs of postpartum hemorrhage are and when to seek out support. Understand the importance of nutrition during the first 40 days postpartum. So that's like what I had mentioned before. Whatever your cultural significance is around postpartum healing and care, how can you utilize those skills and those tools that you've learned from others or previous pregnancies? And then what are some things you would like to add on? And then understand the use of mental health screening tools in diagnosing and treating perinatal mood and anxiety disorders. Okay, so postpartum healing and wellness. Like we said before, your body built a baby for 9 months. And for most of us coming into pregnancy, you may have been active, you may have been working out, you may have been feeling, you may have felt the best you felt your whole life. And then boom, you're pregnant. So when we think about that whole 9 month period, after you birth the baby, your body needs just about that same amount of time to fully, like 100%, get back to where it was before you got pregnant. So when we dial it down to those first 72 hours after delivery, there's a lot going on. Your hormones go from building a baby to now trying to making milk. So hormone shift, your milk comes in, and you are bleeding from the area where your placenta was once attached. It's super duper important that you lean on whoever is your support, whether it's partner, doula, auntie, grandma, sister, friend, neighbor, so they can help you with cooking, watching other children, because normal activities like showering and using the bathroom and walking will be all that I would suggest that you can do. And that will probably be all that you can do alone, right? So, like, we don't want you standing up making noodles at the kitchen, at the stove. We don't want you running behind little JoJo because they decide they want to run out the back door. And now you got to hike up and run with the baby. So, just thinking about who's going to be there to support you. As your physical healing improves, be reminded that your hormones are still finding balance. So when we think about that, know that it's normal to have anxiety, it's normal to feel sad, it's normal to have anger and irritability. And of course, it's going to be difficult to get sleep, not because you won't have the time, but because when your baby's sleeping, you may be feeling that, oh, I got this to do, I got that to do. Those are the moments that we're talking about when we say difficulty sleeping. We're going to talk about each of these in the context of postpartum healing. So, when we think about it, when we're saying, mental health, if any of these symptoms persist longer than 2 or 3 weeks after delivery, so that's about, a month after delivery, go ahead and seek support from someone that you trust. So this could be your partner, your therapist, or your primary care provider. And we'll talk about more ways that you can reach out and ask for an early postpartum visit. Sometimes it's virtual. And you can just get on there and the doctor can see you and they're like, oh yeah, okay, she still needs support with here. Or let's do this screening tool to test and see if she has postpartum depression or if she has anxiety. So when we start to think about these things, it's really important to know that what you're feeling is normal. And then if we are experiencing this for longer than 2 or 3 weeks, then we want to start talking to somebody and thinking about like therapy or a support group. Or for some of us, it may be getting back on medication that we weren't on while we were pregnant. So just understanding that these are all options and things that still make you a good mom if you go through. So we think about perinatal mental health. So we're gonna go ahead and talk about the hard stuff because I want to go ahead and get it out there in the open so that we can break all the stigma up about it. One of the things that most moms are like, oh, baby blues, baby blues, baby blues. It's like that's normal. That's what we're talking about with this hormonal fluctuation. That's what we're talking about when you feel really tearful or you feel anxiety or you feel irritable. One of the biggest things that happens is your body, like we mentioned around the hormones from last week, your body has all these hormones surging through your body, surging through your body. And then as soon as your baby comes out, the only hormone that's left that hasn't gone away as a result of the pregnancy is that oxytocin. So when we're thinking about a hormonal level, if everything bottoms out and you got this peak experience, it's just like when we go and travel, right? We go and travel and we have a great time. And we take all these pictures and we have a awesome grand time while we're there. We dreaming about the ocean. We dreaming about wherever we are. And then we get back home. It's like, dang, I just had the best time of my life. And now I'm back to this, right? Same idea, but we're thinking about our hormones. We had this peak experience of our hormones hitting this level that most of us have never experienced before. And now we're all the way back down. And the only thing that can bring us up is oxytocin. The only thing that can bring us up is looking at your baby, is feeling supported, is watching them. Dopamine and all those endorphins, those things are still present, but because of that low, it takes more of those to be able to feel back to normal. So we have to ride that oxytocin train for as long as we can. And a lot of what will happen during baby blues can be mitigated by finding things that you're grateful for, going outside, enjoying time with family and friends that are bringing you support, whether it be hands-on, whether it be Grubhub, whether it be video call, just doing something that'll break up the monotony of your day, but then also be able to look back and say, I built this baby, like regardless of what the outcome was for the labor and delivery, whether it was a vaginal birth, whether it was a cesarean, whether it was an emergency C-section, whether it was an induction, no matter what it was, at the end of the day, you and your baby are safe. And if there's anything that you want to work through, that's when a doula or a therapist can talk with you and you can journal out what your birth experience was. And that leads us into birth related PTSD. So, when we start thinking about perinatal mental health, these things, the only thing that is specific to having a baby is the baby blues, right? Everything else just happens because of life and because of hormones and because of experiences. So, when we start thinking about it, we're not just going to call it postpartum depression, we're just going to call it depression. We're not gonna call it, you know, we're not gonna put it in there with the sense that it only happens during delivery or in postpartum. When we think about it by and large, birth-related post-traumatic stress disorder, it looks like having things happen to you that you did not know were gonna happen and they weren't explained to you, and it makes you afraid of what's to come, right? That's what all this is basically saying. It's saying that it could be you don't feel supported when you are trying to let the providers know what you need. So then it results in a breakdown in communication and no one takes the time to explain something to you. That could be traumatic for people. Any kind of physical condition that happens, whether it be during pregnancy, during labor, or even postpartum, preeclampsia, postpartum hemorrhage, or even having to get something like a episiotomy, which would be considered severe perineal trauma. So these are all things that would make our body say, oh my goodness, this was so scary. I want to do everything I can to avoid this trigger. I want to do everything I can to not have this happen. And then when you are put into those situations, this is when the anxiety and the fear and then even like the anger and lashing out can come. So just know that it's normal. And if you have had any of these experiences, or you feel like in the you have them in the future, then it's really good to talk to someone and to journal it out and to be able to acknowledge that it happened so that you can move forward emotionally and let people know, let providers know what's going on so that they can move in a more culturally appropriate as well as a more like trauma informed way. So, like I mentioned, we're going to call depression depression because it's only perinatal mental health because of the time frame in which it takes place. So, when we think about depression around pregnancy and delivery, it can look just like regular depression. So, the sadness, the tearfulness, the loss of interest in normal activities that you find fun, feelings of guilt, worthlessness, having severe fatigue. So, this looks like you just woke up in the morning, you ate, and then you was like, you know what? I'm not doing nothing. I'm going right back to bed. That's what we would mean when we say like extreme fatigue. You're kind of just isolating yourself. Sleep disturbance, change in appetite and digestion. Now, this one is like if you have this situation when you're pregnant, it's like, okay, that's normal. But when we couple those with other symptoms, that's when we would start to look at it like if you didn't have interest in doing things that you normally do, or you're saying, oh, I'm getting fat because I'm pregnant, or in the postpartum period, this would look like, oh, I'm trying to snap back. So I'm just not going to eat anything, or I'm having loose bowels because I'm dealing with the mental and emotional strain of just feeling low, poor concentration, and suicidal thoughts. So these are all things and these are all symptoms that could be categorized as depression. And when they happen in the postpartum period, this is when we start thinking about it around what we know as postpartum. And everybody says like, oh, I got postpartum. It's like, no, that's a phase, that's a stage in life, but you got postpartum depression. But in reality, it's just it's depression. We're gonna call it what it is. Okay. Now, when we think about pregnancy or postpartum obsessive symptoms, now I'm going to pause and share it real quick because I want to have a discussion with y'all and I want to tap in with first. And okay, so um, In reflection of this slide, I just want to note and make it clear to anyone who is listening that postpartum OCD is not something that just affects moms. It also can affect the support people, fathers, partners, anybody who's staying with you in the home and supporting you through your process can also develop these symptoms. And the symptoms are not delusional in nature, but they are things that come up out of the blue and can also be very scary. But the person who's having the symptoms do everything they can to avoid the triggers and avoid any harm to the baby. So we're not talking about, like psychosis or anything related to like dangerous hallucinations or anything, but we're talking about things that could definitely happen in real life, but we're doing everything we can to avoid them. And that's how OCD shows up in the postpartum period. So let's talk a little bit about what your healing looks like physically. So we talked about the emotional part around the mental health. We talked about all of that, and in this particular part of the presentation, I want to talk about the physical healing. So, what is alokia, loci, bleeding, whatever you want to call it? I'm going to call it loci. Y'all can call it whatever you want. But this is the name of the discharge that comes after you deliver placenta. So, the reason why we call it discharge is because it's not just blood, right? So, the first 15 to 20 minutes after your placenta is delivered, you may have a little bit of of bleeding that is literally just the wound starting to close and clamp down. So this is what that discharge is called. The placenta was attached to your uterus. So when the uterus comes out, the wound is present and naturally bleeds. So the bleeding is a mixture of blood, mucus, uterine tissue, and things that are no longer needed after delivery. So within the first 4 days, we call it loci rubra. Okay, so this is the first stage. It is dark red to bright red, and it flows like a heavy period. Now, in the hospital setting, you may hear them say, oh, it's just like having a heavy period. Yes, but it is not a period. Okay. So understanding that there is a wound the size of the inside of your palm on your uterus that now needs to squeeze down and clamp down. Your uterus starts to contract while you have the baby, while you're delivering the baby, and then after you have the baby, your uterus is still contracting as your body releases oxytocin. When you pump, when you breastfeed, when you hand express, when you feel love for your baby, all that timing, you may have cramping. You may have that feeling of like, oh, I feel like I'm having labor pains again. That is normal. Okay. We actually want you to feel that within the first 24 hours because we know that the uterus is doing its job and your body is releasing an adequate amount of oxytocin. Additionally, in the hospital, it is standard practice for doctors to give you a shot of Pitocin. So the difference between oxytocin is your body makes it naturally. Pitocin is an artificial hormone that does the same thing that they give you a shot of. If you haven't had it throughout your entire delivery or your labor, that's fine. But as soon as it's time for placenta to be delivered, that will be put either in a shot on your you'll get a shot in your butt, or it'll be put in your IV, depending on where you deliver in the hospital, or if you're having a lot of bleeding on an out of hospital birth, they will administer Pitocin as well. Okay, so just being mindful of that. You will more than likely get Pitocin once it's time to deliver placenta. Okay, now getting back to loci rubra, if you have clots, they are small. They are no bigger than the size of a quarter. If you have any clots that are larger than that, we need to let somebody know. We need to ask a provider, say, hey, I passed a large clot. Do you want to know how big it was? Or I took a picture. Here, look at it. Whatever that looks like, go ahead and send that in so that they can ensure that it is not something that needs to be looked at again, and they can adequately assess your uterus and your bleeding. Moving on to the next stage, loci serosa, the upper right-hand corner. This is the second stage of healing. This is when your bleeding goes from being like that thick, kind of heavy flow, very viscous. That's the best word for me to think of. To now it's more watery, less bloody. So it's like a pinkish brown. At this point, this is around day 4 to about 2 weeks. So 2 weeks after delivery, you still may have this loci serosa, and that's okay. The only thing to note is that the flow is moderate. So that means that if you move, you might flow a little bit. If you are sitting up or when you just get out the shower, your flow may increase. But at this point, you should have no clotting. And if you do, they're stringy. It's not those big clots that look like, like the size of quarters. Okay. And then we get to the last stage of the loci healing. It's the yellowish to white discharge called alba. And there's little to no blood. It's a light flow or spotting. And for most moms, this is the point where they think they're finished bleeding, right? And this is just their new normal vaginal discharge. I'm here to tell you it's not, okay? This is still a part of that 6 to 8 week mark of your physical healing after delivery. And at any point in this alba or serosa phase, if you do too much, like if you decide you're gonna go for a mile walk or 2 mile walk, or you decide you're gonna start back lifting weights, or you had a busy day with doctor's appointments, your bleeding can go back, your bleeding can regress. Okay. So when we think about that, that's your body's way of saying, sit down. Do not do whatever you just did again tomorrow. You need to relax. Okay. And when we think about this in the alba phase, if you are partnered and you are having sex with someone who can get you pregnant, this is a phase where you need to be very mindful, because at this point, it's almost been 6 weeks. And if you live with that person, you may be feeling like, oh, we did this, we're in this together, it's been amazing, da 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 da. This is how we end up with babies born about 9 to 12 months apart. Okay. Oh, yes, yes, thank you. We're gonna stop the share in a second. We could talk more about it. Okay. So when we think about this healing process, how long do you all think, and you can drop it in the chat, I'm also gonna pause the recording. How long do y'all think that you should be waiting to have sex or be intimate with someone who can get you pregnant? All right. So the final thing that I want to mention around the healing phase is for, culturally, for me growing up in the South, this part of the healing was very much regarded as the time where mommy is being waited on, hand and foot. If she wants water, you go get it. If she wants a snack, you go make it. If she wants to get outside, you go get everything that she needs outside and get her ready before you tell her to come downstairs. So when we start thinking about support and what it looks like, not only are you dealing with the emotional aspect, you're dealing with the physical. And now we're going to talk more about the tips that you can move through and hope that people around you will be open to, as well as supporting you so that you can focus on healing. So stay regular. And when I say stay regular, I'm talking about pooping and peeing. Okay. Your first postpartum bowel movement can take time. Don't force it. Okay. Make sure that if they give you stool softeners, take them. If you don't want to do that, some warm water with some lemon and some chia seeds will do the trick, or having some okra water will do the trick, or drinking some warm tea before bed and some warm water in the morning when you wake up. Those will all help to get things moving. It's also suggested that you eat plenty of fiber-rich foods like whole grains, fruits, veggies. Go for walks and avoid straining. Okay, we don't want you to re-tear something that already tore naturally during labor, or irritate a C-section scar if you have it. One of the biggest things that happens for most mamas during postpartum or during labor and delivery is because of the pushing, this position that they're pushing, or because of the pressure that's happening on their rectum and their anus, they can potentially have hemorrhoids that they did not have to begin with. So when we think about that, that's what I'm saying. Don't force things. Like, just let it move. If it's not ready, get up, maybe go for a walk, do some stretches, come back and try again when you have the urge. Okay. Do your Kegels. There's no better way to get your vagina back into its normal shape and make sex more enjoyable for you and your partner and resolve postpartum urinary incontinence, no matter how you delivered. So when we think about Kegels, we're imagining that we are like, we're imagining that we are pulling up. So we're drawing our vagina up into our stomach. So not just squeezing it and clenching it, we're drawing it up. We're pulling it closer to our belly button. We're pulling it up. So every time you do it, you're just thinking about, I'm pulling it up. I'm pulling it up. And it starts with maybe you do 10, right? Maybe you do 10 one day, and then the next day you do 20. Okay. And then once you hit 20, try to do 3 sets of 20. Okay. And it doesn't have to be back to back, it can be throughout the day. Okay. And one of the things that I will say is don't do Kegels on the toilet. Okay. Don't cough on the toilet, don't do Kegels on the toilet, because that pelvic floor is very sensitive, and it's easy when we are using the restroom, because there's a hole, to allow that pressure to just go right in. We don't want that pressure to go in. We want you to draw it up, and we want you to be able to have a hard surface to draw it up on. Okay. Same thing with coughing. We want to make sure we're coughing on a hard surface and not on the toilet. Okay. I don't know how many times I've heard somebody in the bathroom stall next to me coughing, and I'm like, oh girl, your pelvic floor mad. So just be mindful of that. Okay. Be mindful, especially in those first 40 days. And then the final thing for postpartum healing is be kind to your breasts. For achy breasts, you can use a warm compress before you feed your baby, and then a cold compress after, if you want to help alleviate discomfort around your nipple or areola. Also, gentle massages. So we're going to talk about a gentle massage, what that looks like. So here's my handy dandy booby, and she's here. When we think about a gentle massage, we're putting our arms up and we're massaging all the tissue from in our armpit all the way down to the nipple. Okay. And we're not forgetting about the under boob. Okay. We're massaging that towards the nipple. And then we can just give it like a little squeeze, a little rub. And then it's really good to do it right when you get out of the shower, because you're already naked and you can just rub the oil on and keep it going. So when we are thinking about nursing our babies, we want to wear a comfortable nursing bra. So no underwire. It should fit loosely. It should not squeeze and compress your breasts. And then also, if you're getting ones that have that little clip that you can flip down to feed baby or to use a breast pump, understand that sometimes that extra bit of material underneath it can compress as well. So get one that's stretchy, that you can move out of the way so that your breast can be exposed. And I am a big believer in let them hang, let them air out. Your boobs are already sensitive now while you're pregnant, but they will likely be even more sensitive after. So if you're just wearing a loose t-shirt or just a robe, it'll be a lot more comfortable when you're going through those early phases of breastfeeding than trying to put a bra on or trying to put on a tight shirt, because that compression can really be uncomfortable, and it can also reduce your milk production. Okay, so let's talk about nutrition. So when we're thinking about postpartum nutrition, during your staying in period, it is recommended by the Centers for Disease Control and Prevention that you increase your caloric intake by about 350 calories per day. Also, choose foods that are easy to digest. So when we think about easy to digest foods, it's going to be soups, it's going to be fibrous foods. It's going to be well-cooked foods. I'm not saying dry foods, but when we think about it from perspective of cultural foods for Black people, this is like a very slow cooked pot roast. That's perfect. A good chicken noodle soup, amazing. Some collard greens and the pot liquor, amazing. Maybe you have I don't know. What's another one I can think of? Maybe you have a steak, but instead of having the steak medium well, you do it medium or medium rare so that your body can digest it easier than having it be chewy, right? So when we think about it from that perspective, we're thinking about foods that can pass through, your body can absorb the nutrients, and you can poop it out easy with no gas, with no discomfort. I would suggest staying away from broccoli and cheese and things that bring us gas. Beans and bean soups are okay as long as they've been prepared to skim that skin off, as well as that scum that comes on the top of it that causes the gas. Okay. And your first 3 months of postpartum will feel like a revolving door of eating and feeding your baby, but rest assured that this is what your body needs to heal and to adequately feed baby. Okay, so if the goal is breastfeeding, we need to understand that the first 3 months, that is where either moms get on it and don't stop, or they have struggles as a result of inadequate support or not feeding themselves. So here's a calorie breakdown. So in the morning, as soon as you wake up, maybe you fed baby at 4 or 5 o'clock in the morning. Get you a snack, a little cheese stick, maybe a yogurt, maybe some carrots and some hummus. Just get you a snack. Break your fast when baby wakes up in the morning. And then so you guys go back to sleep until 6 or 7 o'clock. Get up, then feed the baby. After you feed the baby, have breakfast. Baby falls asleep for another couple hours. Maybe you fall asleep, or maybe you get in the shower. When you get out of the shower, get you a handful of nuts. Get you some jerky. Get you something that's going to be protein dense or vegetable. Okay. If you have gestational diabetes, or you have diabetes in general, you are still at risk for continuing to have that issue in the postpartum period. So be very mindful about the sugars and the carbs that you're eating if you're not pairing them with protein. Okay. And for those of you who do have gestational diabetes and may not be, what we would consider to be like a typical person who has gestational diabetes, that would be like overweight or morbidly obese. A lot of moms who have gestational diabetes are small because they're not eating, and their body is still in that, oh my goodness, now we're fasting. Oh my goodness, now we ate. Now the sugar's spiking. So understanding that breaking your fast in the morning is going to balance out your hormones, it's going to balance out your blood sugar. Ensuring that you're eating adequately throughout the day is going to keep everything streamlined so that you don't have to worry about those fluctuations. You don't have to worry about pricking your finger continuously or having to potentially get a shot of insulin. And we're looking at a 2,000 calorie per day. Okay. 2,000 calories. Now, a lot of us don't know 2,000 calories. Okay. Most people in Los Angeles, and I would beg to say most women in general, operate anywhere from about 12 to 1,600 calories per day. And that is a bare minimum. And most of those calories are not protein calories. Those aren't things that are being given back to our body and our cells. That's like a quick little boba, a little bit of matcha, some caffeine, that type of thing. Okay. Or it's a sugar, or it's something that's a short-lived source of nutrients, like chips or something like that. So please be mindful that in postpartum, you need to be eating the same way you was eating during pregnancy, or better. Yes, you may get sushi right after delivery. Yes, you may, because that is jam-packed with protein. It's easy to digest because it hasn't been cooked. And as long as you don't have any, issues around gestational diabetes with the rice or the soy sauce, you should be fine. Good question. All right. And if you don't know, what am I going to eat? How am I going to make this work? Here are some options. Feeding snacks, spinach dip with pita, granola bars, macaroons, smoothies, trail mix, lactation cookies, or tea. These are all options that you can have with your feeding snack. Okay. What about breakfast? Quiche, yogurt with granola and fresh fruit. That's a perfect one. The quiche has the eggs. It probably has some sort of meat like bacon in it. It's got a little bit of cheese. You get even more protein and healthy fats from the granola and the yogurt, and then you got a little sugar on the top with the fresh fruit, okay? For lunch, slow cooked meats, like we were talking about the pot roast. Vegetable soup is good. Roasted Brussels sprouts. These are all great options that you can pair together or even pair them with other things to help balance out protein heavy, vegetable heavy, carb light meals. Okay. For dinner, we got salmon, sauteed kale, sweet potatoes, or maybe just a simple chicken soup. And then dessert, you all deserve dessert, okay? This can be interchangeable with a feeding snack. Berry sorbet, frozen yogurt, granola bars, macaroons, smoothies, or tea. So when we think about these meals, this is where I always want to encourage you as postpartum folks who are going to need to lean on your village. Call on the people you love their cooked food. Or if you don't know nobody who cooks good food, find somebody who cooks good food. Or tell people to put money on your Grubhub or put money on your DoorDash so you can DoorDash good food. Okay, because this is going to be the place where breastfeeding will break down if you are not adequately nourished. This is going to be the place where mental health breakdowns if your body doesn't have what it needs to replenish the stores that it gave up for baby and now it is giving up for breastfeeding. Okay. Now, before we finish up for today, I'm going to stop to share once more.